Treatment and prevention of pediatric pneumonia. The initial treatment is started according to the symptoms of the disease and the age of the children, whether they belong to younger category or the older children or the infants, that is under 1 year age. Initially, we provide the analgesics and the antibiotic treatment in the form of oral form, that is syrup forms. Especially, we start with acetaminophen and the brufen preparations. In the case of bacterial pneumonia, we advise in the babies ampicillin drugs, syrups or the drops, to reduce the severity and the growth of the bacteria, which has been calculated according to the blood culture and sensitivity in the labs. Next, there is a series of antibiotics. We can also choose amoxicillin in the older and the younger children. Third generation of cephalosporin group, ciprofloxacin, levofloxacin, and the moxifloxacin. These are the drugs which can be used for reducing the severity and the treatment of the bacterial pneumonia in the children. Recently, the new groups has been added in the medical therapy, that is azithromycin and the clarithromycins. They are also used in the upper as well as the lower respiratory tract infections, even in the children and the adults, and also used in the adolescents. So these are very effective one. Azithromycin is used in the form of 500 milligram for 5 days. Now when the severity is greater, then we have to admit the children in the hospitals for the IV therapy. So when the children is admitted in the hospital, the immediate process is we provide everything every treatment in the IV form. That is, we provide antibiotics, especially the injection ceftriaxones in IV form. So these are the basic steps we adopt as a first step for the treatment of the children suffering from pediatric pneumonia. In addition to this, if it is from the viral origin, antiviral medicine, that is acyclovir medicine, they are also given to cut off the severity of the viral pneumonia. So the antiviral treatment must be started within the 2 days after the appearance of the symptoms, because delay in the treatment, that brings no satisfactory results. So immediate start of the antiviral medicine is compulsory for the satisfactory treatment of the pneumonia. So these are the various steps which is performed for the treatment of the infected caused by the pathogens by the medical treatment. Now, the prevention of the pediatric pneumonia. First is the provision of the pollution-free atmosphere in the homes, avoid overcrowding, and also adopt the hygienic principles and hypotheses. You have to teach the older children how to wash their hands with soap water, and also provide them the masks if someone is suffering in the home from this infectious disease. Isolation is necessary. Now, For the preventive measure, the basic thing is immunization, that is vaccination against the influenza and the pneumonia. It should be done regularly every year. So this is the first step to prevent the prevention and the production of the pediatric pneumonia. Breastfeeding must be advocated and motivated in the mothers at least for first 6 months, because in the early years the infant has a developing immune system. The resistance of the body is very less one against the pathogens, so we have to provide the antibodies through the mother milk to the infants. So breastfeeding must be advocated, must be emphasized, and must be given. Teaching should be important to the mothers. The the importance of the breastfeeding and the vaccination. These are the main two factors, essential ones. Then the healthy diet of the children is necessary, which should be consisting of protein, minerals, vitamins, and carbs and fat. This essential factor of the diet must be provided for the development of the immunity in the children. Because the first line of defense of the treatment is the body immunity. Immune system must be strong, but as the children, they are the developing ones, so their immune system is at the primitive level, that is in the initial developing state, so it cannot fight against the pathogens or the infections causing the disease. So breastfeeding provides immunity to the babies, and immunization or vaccination provides the immunity and the strength to fight against the various diseases. Now, when the children suffering from the pediatric pneumonia has been admitted in the hospital, when the case is very severe one, then we also estimate by the oximeter the percentage of the oxygen. If it is less than 90%, then immediately provide supplementation of the oxygen. And if the critical state is declared, then artificial or the mechanical ventilator is also advised and is manipulated to save the life and the mortality of the children in the pediatric pneumonia.